Smoking is incredibly harmful. It not only affects the smoker, but also those around them through secondhand smoke. The chemicals in cigarettes are toxic and can lead to severe health issues over time. It damages your lungs, heart, and overall health. The tar and chemicals in cigarettes can cause chronic obstructive pulmonary disease, emphysema, and even lung cancer. Your heart is also at risk, with increased chances of heart disease and stroke. Quitting smoking is the single most important step you can take to improve your well-being. By quitting, you are not only protecting yourself, but also your loved ones from the dangers of secondhand smoke. When you stop smoking, your body starts to heal almost immediately. Within just 20 minutes, your heart rate and blood pressure drop. In a few weeks, your lung function begins to improve, making it easier to breathe. Your risk of heart attack, stroke, and lung cancer decreases dramatically. Over time, your body continues to repair itself, reducing the risk of other smoking-related illnesses. Quitting smoking also improves your breathing, circulation, and energy levels. You'll find that physical activities become easier and more enjoyable, and your overall stamina increases. It's never too late to quit and reap the life-saving benefits. No matter how long you've smoked, stopping now can lead to a healthier, longer life. Take the first step today and embrace a smoke-free future. Nurses play a vital role in helping patients quit smoking. They are often the first point of contact for individuals seeking help to break free from nicotine addiction. Their compassionate approach and medical expertise make them uniquely positioned to offer both emotional and practical support. They provide support, education, and resources. Nurses can offer personalized advice and create a tailored plan that fits the patient's lifestyle and needs. This includes providing educational materials, discussing various quitting strategies, and recommending support groups or cessation programs. Nurses can assess a patient's smoking history, triggers, and readiness to quit. By understanding the unique challenges each patient faces, they can develop a comprehensive plan that addresses both the physical and psychological aspects of addiction. They can provide counseling and guidance tailored to the patient's needs. This might include one-on-one counseling sessions, motivational interviewing, and ongoing follow-up to monitor progress and make necessary adjustments to the quitting plan. Nurses also play a crucial role in educating patients about the benefits of quitting and the risks of continued smoking. They can explain how quitting can improve overall health, reduce the risk of chronic diseases, and enhance quality of life. Their support and encouragement are invaluable throughout the quitting journey. By providing a steady source of motivation and reassurance, nurses help patients stay committed to their goal of becoming smoke-free, ultimately leading to a healthier, happier life. There are many evidence-based interventions for smoking cessation. Nicotine replacement therapy, or NRT, provides a controlled dose of nicotine to reduce cravings. Medications like bupropion and varenicline can also help reduce cravings and withdrawal symptoms. Behavioral therapies, such as counseling and support groups, provide coping strategies and motivation. Combining these methods often yields the best results. Quitting smoking is not just physical, it's also mental. It's important to understand that the journey involves both your body and your mind. The cravings and habits are deeply rooted, and addressing them requires a holistic approach. Identify your triggers and develop healthy coping mechanisms. This could mean keeping a journal to track your progress and emotions, or talking to a friend who understands your struggle. Finding what works for you is key. Engage in regular exercise and find activities that you enjoy. Physical activity can help reduce cravings and improve your mood. Whether it's jogging, playing sports, or even a simple walk, staying active is crucial. Surround yourself with a supportive network of family and friends. Their encouragement can make a significant difference. Spend time with loved ones who uplift you and keep you motivated on your journey. Celebrate your successes, no matter how small. Each step forward is a victory. Reward yourself for milestones reached and acknowledge the progress you've made. This positive reinforcement can boost your confidence. Remember that setbacks are a normal part of the process. Don't be discouraged by them. Instead, view them as learning opportunities. Each setback is a chance to understand your triggers better and to strengthen your resolve. Don't be afraid to seek professional help if needed. Therapists and support groups can provide valuable guidance and support. You can do this. Believe in yourself and take it one day at a time.